Hello. If you are a woman and you leak urine, then this video is for you. In this video, we will talk what urinary leakage in women is, what are the types of incontinence that can happen in women, and what are the treatment options that are available today that you should pursue. Hi, I am Dr. Vijayant Govinda. I am a urologist and a urogynecologist in New Delhi, India. I treat women's incontinence problems. So, incontinence in a woman basically means that you are leaking urine, and you're leaking urine against your wishes, which is obvious. No woman wants to leak. No, all women want to remain dry. Leakage in women is a big problem because it causes embarrassment. It causes a lot of bad hygiene and bad smell, and a leakage problem can really hamper a woman's social life. So, why does incontinence happen? So a woman's body is in a constant change of flux. As she grows and she produces children, the pelvic floor muscles, the PC muscles get weak. This weakness can happen due to many reasons. It can happen due to hormonal changes. It can happen due to the stretching occurring during childbirth. It can occur due to neural injuries. It can also occur due to episiotomy if it has happened. So and it can also occur due to the weight bearing of the baby. Because of this deficiency in the PC muscles and the pelvic floor muscles, it can lead to a state where it becomes difficult to control urination. So incontinence in women can basically happen in 3 to 4 types. One incontinence is that the women when strains in the form of laughing, strains in the form of coughing, strains in the form of getting down from the floor and getting up, or strains in the form of exertion, running, aerobics. Due to this straining, some amount of urine may leak. This urine leakage may be very little, as if to just drench the panty liners, or this urine leakage may be in a large or copious quantity in which the patient actually has to change her undergarments 4 to 5 times a day. So depending upon the quantity of leakage, it can be divided into mild, moderate and severe, but this particular form of incontinence that happens during exertion is called as stress urinary incontinence, or SUI. Another form of incontinence that can happen in women is called as urge incontinence. So urge incontinence means that a woman is sitting comfortably with her family and friends, or is just meditating, and suddenly she gets this sudden urge to pass urine. And with this urge, she has to rush to the bathroom, and some amount of urine leaks even before she is able to reach. This episode usually occurs due to an overactive bladder, and this could be signs of UTI, stones, infections, again neuromuscular discoordination. And in this problem, the problem is not with leakage. The problem is that the woman is unable to control or postpone her voiding to the limit where she can void comfortably in the bathroom. Now there may also be a condition in women which is called as MUI, or mixed incontinence, in which the patient has components of urge as well as component of stress. Some women have something called as stress-induced urge incontinence, which is a developing modality in which the patient coughs. On coughing, she feels a drop of urine coming out, and as soon as a drop of urine touches her undergarments or touches her urinary meatus, she gets this intense urge to pass urine, and then the incontinence happens. So this is basically stress-induced urge incontinence, which is still an investigative type, and a treatment is still in a flux. Then there is something called as a continuous incontinence. Continuous incontinence means that the woman is leaking all the time. A continuous incontinence may be due to severe stress incontinence, or a continuous incontinence may be due to a vaginal fistula in women who have had hysterectomy or cesarean section earlier. There is also a condition called as nocturnal enuresis, or bed wetting, in which the patient is comfortable throughout the day, but at night at 3 a.m. or 4 a.m. she wets the bed. So in all these conditions, treatment is required. Before treatment, it is important to understand that all treatment is not surgical. Today, 90% of incontinence in women can be managed medically without surgical intervention. But for that, it is important to first understand the cause of the incontinence. So when a woman comes in for examination or for treatment for incontinence, the first thing as doctors we need to understand is to classify her incontinence into the types that I gave. Then to classify the severity of the incontinence. After that, there are certain diaries that the patient maintains, which are called as bladder diaries, which lets us know about her bladder capacity and voiding behavior. Then there are tests like uroflowmetry, tests like cystoscopy, tests like cuff test, tests like the Bonnie's test, which help us differentiate between the various kind of incontinence and figure out whether we are dealing with a fistula or an incompetent bladder neck. Then depending on these conditions, other tests like an MRI or a urodynamic study may be required before we decide on the course of treatment for the lady. Now, treatment for these incontinence can vary from different things. We will cover each incontinence in detail in the coming videos, but in general, if we talk, so we have something called as behavioral therapy, we have pharmacological therapy, we have assistive aids and living devices, and we have surgeries. So behavioral therapy would include changes in your lifestyle, reducing the amount of water you take, bladder training, pelvic floor training, Kegel exercises, ability to postpone your urgency. So these would all come under behavioral training. Then there would be something like lifestyle changes, which would include maybe changing your exercises, reducing your body weight, alleviating constipation and other such factors, even estrogen therapy. Then pharmacological therapy would include drugs like anticholinergics, drugs to increase bladder capacity, drugs to increase the tone of the pelvic muscles, drugs to make the urethral mucosa healthy again, and like estrogen suppositories or hormone replacement therapies. Then there are lifestyle and assistive devices like vaginal cups or urethral blocking devices, or maybe diapers if you are leaking very less. And if nothing of this works, then there are surgical options like the surgical slings, which can be made up of synthetic materials or maybe made up of the fascia of your own body. So depending upon your incontinence, the severity of your incontinence and what treatment you require, there is a gamut of treatments available for managing incontinence in women. It is very important that you meet a urologist or a urogynecologist or a doctor who is interested and who has a lot of experience in managing women incontinence, because a wrong treatment can make life even more difficult than leaking urine. If you have seen this video and you feel some of your friends may require the information, please share it with them. Like my video and please subscribe for further updates on women's urogynecological issues. Thank you so much for listening in.